So I'm going to go through this algorithm. I think it's really important to understand how diabetes affects the lower extremity and the foot in particular. So this is a schematic that was developed by the American Diabetes Association, and obviously the American Diabetes Association is a very good resource for patient educational materials and clinician education materials as well. So, you can see at the top of this schematic that, it all starts with diabetes, and unfortunately uncontrolled diabetes. Some patients may not even know that they have diabetes, and so it goes undiagnosed and therefore uncontrolled for a long period of time. Some people, are, again, not adherent with treatment, and again, that could develop into uncontrolled diabetes. And some patients are really good and they try to control their diabetes, and they're really, good about glucose management and checking their A1C and their daily glucose levels. But sometimes, unfortunately, they can still develop consequences of long-standing diabetes. So what are those consequences? Let's look at, first off, the somatic sensory neuropathy. I think this is what most people relate to diabetes, is when patients have lack of sensation. So they don't feel pain, they don't feel temperature, and they also have lack of proprioception. So what's proprioception? That means like where the body part is in the space. So a lot of our patients will have some gait abnormalities and possibly have some issues with tripping or instability because of that neuropathy. And again, we see this sensory neuropathy, so lack of sensation and sometimes painful sensations. A lot of patients will say, have a lot of burning and tingling in my feet, particularly at night. That's one of the most common types of neuropathy, and the most common things that we'll see as symptoms that patients will relate to us. And what can happen is repetitive trauma, ill-fitting shoes. I've seen patients walk down blacktop driveways in the middle of summertime and get third-degree burns on their feet and not feel a thing. I've had patients, step into boiling hot bath water and get burns. They didn't notice until it was too late. Patients have stepped on just about everything, thumbtacks, nails, toothpicks, pieces of glass. They don't even know that they've had an injury until, they see bleeding on the sock or some purulent discharge, or have, see an odor. So, we know a lot about that sensory neuropathy, but we don't really pay as much attention, I guess, to somatic motor neuropathy. So the small little nerves in the feet that innervate the muscles also can waste and be dysfunctional with long-standing or non-controlled diabetes. And what will occur then is those small muscles will waste. So those interdigital and interossei muscles won't get the nerve function. And so what patients will end up developing is foot deformity, so structural abnormalities. So they can develop hammer toes or bunions, and these are increased pressure points. So combined with that sensory neuropathy, they have a bunion or a hammer toe, they have a poor fitting shoe, and that's an area that'll rub and break down. We also have to discuss autonomic neuropathy. So patients with diabetes can develop autonomic neuropathy. This can lead to decreased swelling or sweating rather, and dry skin and callus formation. You remember that patient I showed you at the start of the talk with all that dry skin? That's because she had also developed autonomic neuropathy. And what will happen is the skin will be more friable, more sensitive, and then more fraught for breakdown and ulcer development as well. Peripheral arterial disease is something we commonly see in our patients with diabetes. So patients with diabetes and coronary artery disease, I can bet the farm they also have peripheral arterial disease. So our patients should be monitored. We should at least get non-invasive vascular studies annually. Any patient with a diabetic foot ulcer definitely needs non-invasive vascular studies, ABIs, TBIs. We'll talk about that in a bit as a baseline, and then to track the patient throughout their course of care as well.